First, we will check the patient's leg length by lifting the legs, pushing down the heels and comparing the heels. There we see which leg is the longer one. After that, the correction is done by applying gentle pressure against the hip joint while moving the leg downwards. After that, we show the patient how this correction can be done by the patient him or herself. In this case using the hand or a rolled up towel, which replaces the pressure of the therapist. We proceed with the knee joint correction in the same manner, gentle pressure while moving the knee joint. And when completing this, we also treat the ankle joint in the same way, gentle pressure inwards the joint while moving the joint. After that, we proceed to the sacrum checking and correction. We check the sacrum with our thumbs at the posterior superior iliac spine, and when we find an uneven area, we then continue doing the correction. The correction is done by applying gentle pressure or counter pressure while the patient is swinging with the leg and therefore distracting the muscles in the hip pelvis area. Remember, the therapy must never cause pain. We always do this on both sides of the sacrum or the pelvis to ensure the best position of the sacrum. Following this, we go to the spinal correction, starting with the thoracic spine. We palpate the thoracic spine using our hands. Once we find an uneven area or a misalignment, we may correct this with applying gentle pressure, counter pressure at this area against the spinous processes. Again, the patient is doing certain guided movements, in this case again a swinging of the leg. Also, this must not cause any pain. Proceeding to the upper spine, we do the same. We palpate the upper thoracic area of the spine, left and right of the spinous processes. Again, when we find any areas of uneven tension, misalignments, we apply gentle pressure, counter pressure using our thumb or hand, finger, while the patient is doing certain movements, in this case a swinging of the arm, or if appropriate both arms alternate. This correction again must not cause any pain. If we find a curvature, we do this correction in a sliding motion, sliding from up to down against the curvature to correct scoliosis and small curvatures in the upper spine. In this case, the patient is swinging both arms alternate. Following, we go into the correction of the cervical spine, the neck, starting from C7 upwards. Again, if we find any misalignments, we apply gentle pressure. In this case, the patient is swinging the head like a no-no movement from left to right. And C2 to C6 is checked in the curve between the muscles at the neck, and the correction is applied by applying gentle pressure with a finger. Again, the patient is swinging the head or tilting the head from side to side. This is a sensitive area, watch out for pain. The upper two, atlas and axis, are also corrected. They are very important areas for the whole spine. Migraines, headaches are usually rooted here. We apply gentle pressure. The patient is pushing himself or herself against our thumb while doing certain guided movements. In this case, again, it's a tilting of the head from left to right, like saying no, no. A very effective way of correcting the atlas is also applying pressure on both sides at the same time, while a coordinated breathing from therapist and patient is necessary, during which a gentle pressure and movement is applied. Following the spine is the correction of other joints like shoulder, elbow, hand, finger, collarbone, sternum, and TMJ, mandibular joint. The shoulder joint is corrected by applying pressure, and the joint is brought to a 90-degree position and then brought down under pressure gently several times. Similar with the elbow joint, we bend the joint, pressure is applied towards the joint like you break a branch kind of thing. Now exhale and straighten the joint while constant pressure is applied. Hand and finger joint in the same way, pressure towards the joint and movement of the joint from bended to straight position. In the finger it's the same. None of these corrections should cause any pain to the patient. Once we finished elbow, finger, hand and so on, we can proceed to the sternum collarbone joint. We can press with the ball of thumb onto the joint while the patient is now rotating the shoulder to achieve the best movement. This is a sensitive area, watch out for pain here. The mandibular joint, very important for patients with migraine and tinnitus. We follow the joint, moving backwards and applying pressure towards the joint while the patient is simply closing the mouth, and we apply gentle pressure while the patient is closing the mouth. Or a second way, alternative way, gentle pressure is applied directly onto the joint using the ball of thumb of our hands. The therapist is applying gentle pressure, careful because it's painful often, while the patient is several times opening and closing the mouth. This completes the Dorn therapy. More information you can have in my website. And also, often the Dorn therapy is complemented with a Bruce massage, very advisable in some patients. You can have a complete home pre-study course and a set of DVDs, information in my website. And this completes the Dorn method. Thank you for your attention.